Hello, coders. Good morning, good evening, good afternoon, all. Depending upon where you're joining us from, welcome to another Power Pack session of CPT Guideline Mastery here with AMCI. How are you all doing? Hi, Miss Mills. Okay, thank you for letting me know, Miss Mills. Hi, Miss Catherine. Who else are here with us? Okay, I think it will take some time for everyone to come in and settle. Okay, so I hope you all are doing great, feeling energized. Hi, Tanya. Okay, now I can see people are coming in. Okay, all right. Okay, so I don't want to waste any time today. So let's get started straight away. Let me read out the copyright CPT copyright 2026. American Medical Association All Right Reserve. CPC is a registered trademark of AAPC. The AAPC content found within this presentation is a copyright of AAPC. Keyword concept: FTR Chun, AMCI Fab 7, AMCI ICD 10, Flip Tab, and MCG are the trademark of AMCI. The credential: CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credential, and the credential CCA, CCS, CCSP, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. All right. So before we begin, a quick reminder, coders. I would really request you all to take a moment and fill out the survey form. I will place it now, by the way. You can fill it out towards end of the session and let me know how you feel, as well as you can also let us know the topics which you like us to cover for these group study sessions. Uh, your feedback is really important to us, and we do really look into all the feedbacks as well. So please do take a moment to fill out that survey form towards the end of the session. Okay, so the topic which we are going to review today is from the nervous system. We are going to review the spine decompression procedure coding. Yes, I will be talking about those nerve root decompression procedures today, because I don't think we have reviewed too much of them uh, in this series as well. Hi, Emil Martinez. Welcome to this session. So, Chorus, I would highly again recommend you all to take your CPT book, open it, and have it in front of you if possible. Because today we don't have too much guidelines to review. We do have some of the parenthetical guidelines. Mostly it will be related to the codes and how these codes are classified. And we will also do some exercise on the spine decompression procedures. All right. So it will be very good for you also to look into these codes directly when you have your CPT manual with you. All right. Okay. So these codes or these topics which we are going to review can be found under the nervous system chapter in your CPT manual, and specifically under the subsection spine and spinal cord procedure. So this ranges from 6263 to 63746, and the topics which we will be reviewing will be on the endoscopic, the open percutaneous decompression procedures, and they include your laminectomy, laminotomy, corpectomy, facetectomy, etc. So we did actually review these terminologies in our week 2 under the arthro disease procedures. So don't worry, but I think we will refresh them once again, because I can see there are few new students joining with us today, and that's why we will do a refresh on those anatomy of the spine as well as the terminology related to it. All right. So as most of you know, human vertebral column or spine is made up of series of bones that is called as vertebra, and these vertebra are actually divided into 5 different regions. You have your cervical, thoracic, lumbar, sacral and coccygeal region. So cervical vertebra is comprised of 7 vertebra. Thoracic, there are 12 vertebra. Lumbar, there is 5 vertebra. And spinal or sacral spine consists of 5 fused vertebra that forms your sacrum, and coccygeal has 4 fused vertebra that forms your coccyx. Okay, and coccyx can or is also known as your tailbone. Now another important terminology you must be sure about while coding these spinal procedure is that the difference between what a vertebral segment is and what a vertebral interspace is, because these two terminology, the segment and the interspace, you will find them throughout these the codes which we are going to review. All right, so it is very important you understand the main difference between what a segment is and what a segment, as well as what a interbody is, or interspace is. All right, so vertebral segment actually refers to the single complete vertebral bone, or this is the bony compartment which we are going to deal with, while a vertebral segment includes the entire vertebra along with the structures like vertebral body, the lamina, the pedicels, the transverse process. All those bony structures together forms the vertebral segment. At the same time, when we are looking at the vertebral interspace is actually the space between two adjacent vertebral bodies. So you can take the example in this image. You have L1 and L2, right? Yes. So the space between L1 and L2 is known as the L1 L2 interspace. And this space is where you will have your intervertebral disc. You can see over here the disc is located right between these two segments. Okay, these two bony compartments. All right, I can see few coders are also joining. Yeah, hello, welcome everyone, and be interactive in the comment section as well. So that is a fun way we can learn these concepts. Okay, now I know we have done this exercise in the week two, but let's do it again, coders. Let me know how many segments are there between L1 and L5. You can type your answers in the chat. So remember, the segments are your bony compartment or bony portions. Okay, I will wait for a few seconds. You can place your answers in the chat. Don't worry, even if you get it wrong. Okay, we are not going to judge you here. All right. Hi, Starry Sunny. Welcome to the session. Okay. Anyone else? Go ahead, coders. Go ahead. Place your best answers. So, once again, remember, segments are the bony part. Okay. Yes. So between L1 to L5, you have 5 segments, right? The bony part, you can count it: L1, L2, L3, L4, and L5. So there are 5 bony parts. While how many interspace are there from L1 and L5? Okay. All right. Great. How many interspace? True. You are right. So there are 4 interspace between or from L1 through L5. Excellent. So you all are very clear regarding the segment and the interspace, right? Okay. So the decompression procedures is what we are going to learn today, and the decompression procedures that we will be reviewing are actually performed to relieve the significant pressure on the spinal cord as well as the nerve root. You can look it look in the image. These compression may result from conditions like, for example, you have on the screen you have a disc degeneration. You can see how the normal disc look like and how a degenerated disc look like, as well as the spinal stenosis image. So with the disc degeneration, the disc can lose a height, and this will cause a bulge or herniation, and which may again narrow the space available for the nearby nerves, right? So in spinal stenosis, actually the spinal canal or nerve existing exiting the opening becomes narrowed due to the disc bulge. So the primary goal of the procedures of all these decompression procedure is to remove or widen the structure that actually causes the compression. So the compression can also be caused by neoplastic and other non-neoplastic lesions as well. So the primary goal is always to remove or widen the structure that cause decompression, and that will help to create more space for the spinal cord and nerve roots as well. Okay, so so depending upon the patient's condition, surgeon can choose, or surgeon may go with one or more spinal decompression procedure. And I would like to give you all a visual presentation of what are these procedure. First one, and you will be also hearing about this terminology often in the upcoming slides. Okay, so it's very important to know what these procedures are. First one is corpectomy. So if anyone knows what a corpectomy is, you can type in the chat as well. Okay. So corpectomy is actually a procedure that involves removal of part or all of the vertebral body along with the adjacent intervertebral disc. So you can see the image. The entire vertebral body will be removed in a corpectomy procedure. Exactly. You're perfectly right, Mr. Starry Sunny. Yes, that's what happens in a corpectomy. Then we have a facetectomy procedure. Okay, sorry. Facetectomy procedure over here. So facetectomy involves removal of actually a part or all of the facet. So you can see over here, let me show you the bluish area. This is the facet, and a facet will be removed in this case, and that will create additional space for the nerve roots. Okay, next is a foraminotomy. So again, you can see the blue area over here, the blue area located between these two bones over here. So foraminotomy actually enlarges the neural foramen and the opening through which the spinal nerves exit the spinal canal. So again, that is also a one method through which decompression can be achieved. Next is hemilaminectomy. So hemilaminectomy involves removing a portion of the lamina. So you can see this is the lamina, and only a portion of the lamina will be removed in hemilaminectomy, while in laminectomy, entire lamina will be removed. Okay, and finally we have laminotomy as well, that involves removal of only a portion of the lamina. So you can see from the images as well, all these procedure actually is mainly focused to relieve the pressure as well as create much more space for the compressed nerve root, and that is a primary goal for these procedures as well. Okay, now let's get into today's CPT codes and the procedure codes. So spinal procedures which we are going to cover today are classified based on two things. One is the visualization as well as approach. So when we talk about visualization, we are really asking one question: how is the surgeon seeing the area where they are going to do the procedure? Okay, so there are two main ways. First one is direct visualization. So direct means surgeon is using light based visualization, so they can see the anatomy with their eyes or through surgical loops or a microscope or even an endoscope. Okay, so those kind of procedures are known as direct visualization. And then there is another method which is indirect visualization. That means surgeon is not directly looking at the procedure area or the area where the procedure will be done. Instead, They are using imaging like CT or fluoroscopy to guide the instrument. Okay, so these are the two different visualization methods. So direct means light, indirect means using imaging, right? Now, let's connect the visualization with the approach. So approach, there are three types of approach. One is open, percutaneous, as well as endoscopic approach. There you go. The first one is percutaneous, means surgeon is working through the skin using image guidance like CT or fluoroscopy. And these are not direct method. These are indirect. No, these are indirect methods because they use the image guidance, right? If you remember, the indirect one uses guidance like fluoroscopy or CT guidance. So that's exactly happening over here. And next we have endoscopic method. So endoscopy as a term itself, it means that surgeon uses an endoscope to see the spine. So even if they are watching through a monitor, it is still considered as a direct visualization because endoscope gives light based view. All right. Now, moving on to the next one, third approach, that is open approach. Open means surgeon sees the spine through a surgical approach. Sorry, surgical opening. And they may use their eyes or loops or microscope for open techniques. And open is also another direct visualization method. So these are the three approaches, and all the CPT codes are actually classified. The spinal procedure CPT codes are classified based on whether it's an open, whether there's an endoscopic or percutaneous. All right. So let's first look into the CPT codes under percutaneous approach. So as I said, if you have your CPT manual, please open it and you can look into these codes. First one is 62287 and it is used for needle based procedures performed inside the intervertebral discs. So always keep in your back of your mind that this procedure, the main aim is to reduce the pressure, right? So in this procedure, surgeon actually enters the disc through the skin and removes the nucleus or removes a part of the nucleus pulposus. Pulposus, okay, which is the inner disc material. So the purpose is again to reduce the pressure contained from the contained bulging or herniated disc. Okay, the next one under percutaneous is 62330, and this is used for lumbar spinal stenosis. This is caused by thickened thickened ligamentum flavum. I'm sorry for wrongly pronouncing it. Ligamentum flavum. So again, the objective is to reduce the compression, and we have third code that is 0274T, which is a category 3, and this is also a percutaneous decompression code for the cervical and thoracic region. So thing to remember here is to identify the exact location where the procedure is done, and you can these are straightforward scenarios. All right, next is about the endoscopic code. So we have just one endoscopic procedure code, that is 62380, and as you can see the code language, it includes endoscopic decompression, and along with it laminotomy can be performed, partial facetectomy can be performed, foraminotomy can be performed, dissectomy or discectomy or excision of the herniated intervertebral disc can be performed. And this is only for one interspace, that is a lumbar. All right. So we have reviewed two of the approaches already. One is open and one is endoscopic. So let's do small exercise on what we have saw or what we have learned so far. And here's the first question. This is, I think, much more straightforward. So you don't need 2.5 minutes to answer, but still you can place your answers as soon as possible. Okay. So Question: of the following answers, which best describe the procedure? 62287, 62380, 02748, 63030. A surgeon performs lumbar decompression at L4 and L5 interspace. Surgeon utilizes tubular retractor system to create a portal, and an endoscope is then inserted, providing continuous light, direct light based visualization of neural structures throughout the decompression and dissectomy. Of the following answers, which best describe the procedure? Okay, Kodas, go ahead. Oh my god, I can see the answers are already in the chat. Go ahead, Kodas, give your best answers. It is almost time, Kodas. Go ahead and give your best answers. I can see only few answers in the chat. Don't worry, even if you get it wrong, don't worry at all. Best thing is the participation. All right, I will give you 5 more seconds. So your codes are also in the screen. So all you have to do is to pick the best possible one and place it in the chat. Okay, 5 more seconds, Codus. Okay, so I'm going to work on this one. So if you are still figuring out, you can still place the answers in the chat once you get the answer in. Okay, so what happened over here? We had a lumbar decompression done at L4 and L5 interspace, and an endoscope was used, right? So that's a keyword, and this is a light-based visualization method, and decompression in dice or discectomy is what happened. So looking at the option D, straight away I can say it's incorrect because it's coding for a laminotomy or hemilaminectomy procedure. I don't see that we had a laminotomy or laminectomy, and yeah, it didn't happen. And this is also an open procedure code, right? We had an endoscope use, so that's a wrong option. Option C is coding for 02741, which is for a percutaneous laminotomy or a laminectomy code. Again, approach is wrong. These are for percutaneous. Option 62287, that is option A, is also incorrect. That is also coding for a percutaneous approach. The right answer is going to be option B, 62380, which is for endoscopic decompression of spinal cord, including your laminotomy, partial facetectomy, for laminotomy, and discectomy, and or excision of herniated intervertebral disc, one interspace lumbar. So that's exactly what happened, and the approach is also right over here, right? So yes, it's an endoscopic approach. I can see all when with option B. Wonderful. B for brilliant. So brilliant answers, and option B is right answer. So let's do one more scenario from those CPT section. Here we go. This is a second question. Of the following answers, which best describe the procedure? Option A, 6233052, 6233152. Option B, 6233052, 6233152, 6233152. Option C, 62330, 62331 times 2. Option D, 62330, 50, 6233150. A 61-year-old male presents with lumbar spinal stenosis and neurogenic claudication. Having failed conservative therapy, he is taken to the operating room for percutaneous decompression of lumbar spine. Under continuous fluoroscopic guidance, which is indirect visualization, the surgeon performs unilateral percutaneous lumbar decompression and successfully resects partial hypertrophied, hypertrophied ligamentum flavum on the right side at the three contagious interspace L2, L3, L3, L4, and L4, L5 of the following answers which best describe the procedure. Okay, coders, your time begins now and you can start placing the answers in the chat. Okay, that is time, and I can see a lot of answers in the chat. Okay, this is one of the reason why I thought like this is going to be a good topic for discussion for the CPT guideline mastery. As I said, there are not much guidelines associated with these codes, but the parenthetical guideline actually plays a big role while selecting spinal cord procedures. I can see a lot of people have changing the answer. Wonderful, great that you got it. Even if you got it late, that doesn't matter. And I'm sure we're going to have an aha moment here. Okay, so let's solve this one coders. Okay, so we have a patient with a lumbar spinal stenosis, neurogenic claudication, and procedure inventory. There was a unilateral percutaneous decompression, resection of the hypertrophied ligamentum flavum as well. And it was done at L2, L3, L4, L5, L5, L4 and L5 as well, right? Okay, so there was three interspace in which the procedure was done, and the CPT codes are all the same. Only thing is that we had to figure out which one is the correct one based on the modifiers used. So 62330 is coding for decompression percutaneous with partial removal of the ligamentum flavum, including laminotomy for access epidural and image guidance bilateral, one interspace lumbar. And then we have code 62331 for additional interspace or spaces lumbar. Okay, did you got something here? Let's solve this one. No problem. So option, I would say C and D. Both are incorrect because both are coding for bilateral procedures. Have you gone through that code language in the parent code 62230? These are for over here. These are for bilateral procedures. You can see here, right? And did we have a bilateral procedure? I say that we had a unilateral percutaneous decompression, right? This was a unilateral procedure that happened here. So the parenthetical guideline over here states that for unilateral procedure, report modifier 52 in conjunction with 62330 and 62331, right? Okay. Type in the chat coders if you had a aha moment. Do type in the chat. Okay. And option B is also incorrect. Know why? Once again, you have to read the language carefully. 62331 is for additional interspace or interspaces. See, the parenthetical guideline also make it clear. Do not report 62331 more than once per operative session. That means you should not report more than one. And the code language also makes sense, right? It's for additional interspaces. Even it be one additional interspace, two interspace, three interspace, doesn't matter. You have to only report 62331 once. And again, a 52 modifier has to be assigned because this is a unilateral procedure. And that makes option A the correct answer. Okay, let me know. Did you had an aha moment or not? Great, great explanation. Excellent, excellent, Christina. Awesome, great. I can see a lot of great, great explanations in the chat. You're absolutely correct. Okay, so if you learn something, that is priceless. Okay, so that's what matters. And let's move on to the other sections now. So we only reviewed few CPT codes, and this was a learning moment as well. So next we are going into another approach, which is posterior extradural families. Under this we have pure laminectomy CPT codes, which means that only laminectomy will be performed under these code series. That is from 63001 to 63017. Then we will be moving on to laminotomy or hemilaminectomy codes. Then finally complete decompression codes, which is 63045 to 63048. Okay, so I might pick up a little bit pace because most of them are straightforward, and only thing you will have to remember is to select the codes based on the correct location. Okay, so if you want to go through them again, you have a playback in case I'm going with a little bit more pace. Okay, so first we have I would say pure laminectomy code, and they are from 63001 to 63017. So if you have your CPT manual, you can maybe notate nearby. These are for pure laminectomy procedure, which means from the code language itself, you can see laminectomy with exploration and or decompression of the spinal cord or corda equina without, that's a keyword, without facetectomy, foraminotomy, discectomy. Okay, here also you can see without, the second quote said without facetectomy, foraminotomy, or discectomy. So that means 63001 to 63017 is only for a laminectomy procedures. And the key thing to note here is that for 63001 to 63011 is for 1 to 2 when the procedure is performed on 1 or 2 vertebral segment, while 63015 to 63017 is to be used when the procedure is performed on 2 or more, not 2 or more than 2 vertebral segment. And the codes are again classified based on the location or the region in which the procedure was performed, like cervical, thoracic, lumbar, and you have sacral as well. All right. So remember, 63001 to 63017 is only for a laminectomy procedure. Okay. So let's move on to the next one. Next, you can see on the right side, these are for complete decompression procedure, which is 63045 to 63048. And why I said that? Because again of the code language, they includes laminectomy, facetectomy, foraminotomy, and it is for unilateral or bilateral with decompression of the spinal cord, corda equina, and or nerve root. So it includes like it it is coding for a complete decompression. A lot of procedures are performed here, right? So there is also one guideline which you have to keep in mind over here. You cannot report 63047 and 63048 in conjunction with the arthrodesis code. So uh, if an arthrodesis is performed and a laminectomy is done, and it is significant enough or significant enough to provide a decompression, then you can assign codes 63052 or 63053. So if the laminectomy is done along with decompression, along with the arthrodesis, only to create a space or interspace for the fusion procedure, then you will not assign the 63052 or 63057. So remember, coders, only code them if there is a significant decompression procedure performed, not to create an interspace. All right. And you can see 63052 and 63053 is add-on code, and the code language itself you can see during posterior interbody arthrodesis. Okay, so next let's move on to the other laminectomy procedures. And up to this point, we talked about the decompression and herniated disc work. But here, surgeon is doing laminectomy to reach and remove or biopsy or drain or to treat the lesion inside or outside the spinal canal. All right. And the codes are from 63250 to 63252. This is for AV malformation, excision, or occlusion treatment. Then we have 63265 to 63268, which is for evacuation of intraspinal lesion other than neoplasm. Now here keyword is extradural. And then we have 63270 to 63273, which is for intraspinal lesion other than neoplasm intradural. So 63265 to 63273 is for lesions, intraspinal lesion other than neoplasm. Okay, one is for extradural, the other one is for intradural. And next we have CPT code from 63275 to 63290, which is coding for laminectomy for biopsy or excision of intraspinal neoplasm, right? And you can see how these codes are classified. We have 63275 to 63278, which is for extradural, and 63280 to 63283, which is coding for intradural extramedullary. And then we have codes from 63285 to 63290, which is coding for intradural intramedullary. So you might be thinking, what is intradural intramedullary and intradural and extramedullary, right? So extradural means outside the dura, intradural means inside the dura. So I hope this image will help you understand. So you can see intramedullary over here, okay, and you can see intradural extramedullary, how it is, the how it looks like. And then we have extradural vertebral as well, extradural uh, vertebral neoplasms as well. Okay, all right. Now let's move on to the other types. Again, you have laminectomy procedures with other procedures like myelotomy, drainage of intramedullary cyst or syrinx, rhizotomy, section of spinal accessory nerves, cordotomy. So all these procedures are pretty straightforward. That's why I'm not stressing too much over here. All you have to do is to identify the keyword and understand what procedure is performed and pick the right answer. Okay. And again, next we have another section which is for transpedicular and costovertebral approaches. Again, pick the keyword and look at the approach and choose the correct answer. All right. Now this slide brings into the laminotomy families together. So you can see two sets of code, one on the left side and one on the right side, 63020 to 63035. These are for laminotomy with decompression of the nerve roots, and they include the partial facetectomy, foraminotomy, and or excision of the herniated disc. All right. Now, what's the difference from the other codes, the one on the right hand side? So the main difference is that these codes 63040 to 63044, they are for re-exploration procedures, meaning these are for secondary procedure. You can see the keyword here, re-exploration. So they also include laminotomy with decompression of the nerve root, including partial facetectomy, foraminotomy, and or excision of the intervertebral disc. The only difference is that these series are for re-exploration. Okay, I hope you have noted them. And again, all these are classified based on the region and the interspace. Okay, quickly moving on to the next section, that is for laminoplasty procedure. All right, that we have two codes. One is 63050 and the other one is 63051 for laminoplasty procedure. And laminoplasty, the surgeon will reshape or reconstruct the lamina to create more space for the spinal cord. So here there's no excision. It will be just reshaping and reconstructing the lamina. Okay, let's do another scenario coder. So I've just moved a bit quickly so that we can do some more scenarios. Exercise number 3. So be forensic while answering this one. You're all going to rock on this scenario. Okay, a patient of the following answers which best describe the procedure. Option A, 6304250 modifier, 6304450 modifier. Option B, 63042 63044. Option C, 6304250 modifier, 63044 63044. Option D, 63042 63042 with a 59 modifier. and 63044 and 63044. A patient undergoes bilateral re-exploration, laminotomy, and decompression at L3 and L4 and L4 and L5 to treat recurrent stenosis at previous surgical site. Of the following answers, which best describe the procedure? Coders, your time begins now, and you can place the answers in the chat. Okay. I am absolutely thrilled to see the comment section. Great. Okay. So I did place a banner showing Be Forensic, and I see that you all were forensic on this one. Okay, what did we have here? We had a bilateral re-exploration, laminotomy, and decompression at L3, L4, and L4, L5, right? And this is done to treat the recurrent spinal stenosis. Sorry. So let's look at the CPT codes. All the CPT codes are the same. We have 63042, which is coding for laminotomy or hemilaminectomy with decompression of the nerve root, including partial facetectomy for laminotomy and or excision of herniated intervertebral disc. And the keyword, if you remember, I said in the previous slide, re-exploration, right? And that's what happened here. Re-exploration is what happened, and it is coding for 63042 is coding for lumbar and single interspace. Also, we have 63042, sorry, 44 or 43. I think it's 44. So don't go by the on clicks. It's actually 44 that is coding for each additional lumbar interspace. Okay, that is going to be the code, and both codes are correct. Only thing we have to figure out regarding the modifier, and option B is incorrect because it's only coding for a unilateral procedure. For the bilateral procedure, you have to assign 63042 with a 50 modifier, right? Over here, the guideline says that for bilateral, report 63042 with a 50 modifier. So I can't see a 50 modifier in option B. Also in option D, there's no 50 modifier. So both are wrong. Between option A and C, I saw that most of you were between A and C. Some were jumping back to C towards the end of the timer. And yes, option C is going to be the correct answer because in normal circumstances, I would say option A looks like a good one, 50 modifier bilateral procedure. But you know what? There is a guideline over here, the parenthetical guideline. For bilateral procedure, 63043 is actually reported twice. Same goes with the 63044. So you should not report 50 modifier with these add-on codes. With these add-on codes, you should report 63044 as well as 63043 twice. Okay, and that's what makes option C the correct answer. So go with the parenthetical guideline. I can see a lot of people, yes, great. So again, this must be a teachable moment, and I think you all learned something here. So go ahead, chun your manual, notate these guidelines next to your code, and that's how you won't get it wrong during the board exams. Okay, let's move on to the next one. Here we go. Of the following answers, which best describe the procedure? Option A 22630 option B 22630 option C 22630, option D 22630. A surgeon performs posterior lumbar interbody fusion PLIF at L4 and L5 in addition to necessary bone work to insert the interbody device. Surgeon performs extensive formal laminectomy and bilateral facetectomy to decompress quada equina and exiting nerve roots due to independent severe spinal stenosis. Of the following answers, which best describe the procedure? Alright, coders, the timer has begun. Okay, time's up. Anyone else to please answers? I know I've given only little bit time, but due to time constraint, I had to stop the timer. So if you're still figuring out, don't worry. As I said, playback is available. You can pause and you can answer it later. So let me walk you through this one. So great answers so far. And if anyone's are still planning to place answers, give your best answers in the chat. We have diagnosis inventory, lumbar spinal stenosis, and the procedure inventory. What do we have? Posterior lumbar interbody fusion and laminectomy and bilateral facectomy was performed. Okay, so CPT codes are 22630. Yes, that is coding for the fusion procedure. If you remember, we learned them in the week 2. And if you haven't still watched that video, please go ahead and you can find them under our playlist in CPT Guideline Mastery. Okay, so 22630 is coding for arthrodesis posterior interbody technique, including laminectomy and dissectomy or discectomy to prepare the interspace, single interspace lumbar. So that looks like a good code. And option C, all the options are coding for 22630. And we have 63030, which is coding for a laminotomy procedure. I can see we didn't had a laminotomy or partial or hemilaminotomy. It was not performed here. It was a laminectomy and it was not a partial or a hemilaminectomy. So I would say option D is incorrect. Now between option A, B and C, I see that option A is coding for 63047, which is for, yes, okay, 63047. Oh, all right. Before that code is, let me know, why do you think option C is incorrect? I say that most of you have went with option B. Why would you say option C is incorrect here? Because it's coding for an arthrodesis and the code language says that it includes laminectomy, right? So why do we have to code for laminectomy procedure again? Type your answers in the chat quickly, Curtis. We're almost time, so you can let me know quickly. Why do you think option C is wrong? Anyone? Okay. All right, I will wait for a few more seconds. I think it's there's a small delay uh, between when you place the answers and when I can view them here. All right, so chat is silent, but I do see that coders have chosen option B as well. Okay, no worries. So option B, sorry, option C is incorrect because of the guideline over here. You see the guideline which I told you? Decompression performed on the same interspace and vertebral segment as posterior interbody fusion that includes laminectomy, facectomy, or foraminectomy may be separately reported using 63052. The code 63052 and 63053 may only be reported for decompression at the same anatomic site when posterior interbody fusion requires decompression beyond the preparation of interspace for the fusion, right? And in our scenario, it was explicitly said that yes, in addition to the necessary bone work to insert the interbody, surgeon perform an extensive formal laminectomy and bilateral facectomy to decompress cauda equina and exiting nerve root. So that indicates that there was a significant decompression performed beyond the interspace or beyond the preparation of interspace for fusion, right? So if that criteria is met, you can assigned CPT code 63052 or 63053. So that makes option C incorrect. And between option A and option B, as I said, the guidelines ask us to code 63052 or 53, because if you read the code language, you can understand that 63052 is a code that should be used when laminectomy, facectomy, or foraminotomy is performed during posterior interbody fusion or interbody arthrodesis for single lumbar vertebrae. All right. Did the explanation help? Let me know in the chat, coders. Did the explanation help? I see that a lot of you went with option B, and I'll just wait. Did the explanation help, coders? So are we good with that guideline? Let me know in the chat. Okay, so I see the child is silent. Okay, please do. If you have any questions, you can let me know in the chat. All right. Okay, so I see that yes, Chari Sunny has pointed out a very good point over here, which I missed to say. The open procedures are divided into several other procedures or several other subsection based on the approaches. So we did cover the posterior, we did cover transpedicular or costovertebral. Next, we are looking at anterior approach. Okay, anterior means from the front. So these are the codes for anterior approach, extradural or exploration or decompression. So we have first set of codes that is for discectomy procedure. You can see from 63075 to 63078, they are for discectomy procedure. And then we have codes for vertebral corpectomy that is ranging from 63081, and it will continue till 63091. And all these are classified based on the region, that is cervical or thoracic or lumbar or your sacral. Okay, so for the scenarios, you have to identify the location and then code. Okay, and finally we have some codes for excision of anterior or anterior lateral intraspinal lesions as well. So as I said, most of them are straightforward. Finally, the lateral extracavitary approach for extradural exploration. Okay, since we are almost time, I'm not going too in depth with this one. So they are straightforward, nothing too much to worry about. Pick the keywords, always pay attention to the parenthetical guideline, and you all will be fine. So before we close this, let's do some poll. I have a couple of poll scenarios for you based on the guidelines which we learned today. Type your answers in the chat. These are hand poll scenarios. According to the CPT guidelines, which term describes a spinal procedure performed with indirect visualization using image guidance such as fluoroscopy without a device allowing visualization through an incision? Is it option A, endoscopic, option B, percutaneous, or option C, open? Remember in the beginning, we said there are two different visualization technique. One is direct and one is indirect. All right. Okay. So quickly, Chorus, this is a rapid fire scenario. Quickly, fastest fingers first. And yes, the correct answer is option B, percutaneous. So that is an indirect visualization which is done or performed with the help of guidance like CT or fluoroscopy, right? And there you go. There is your guideline, or there is the definition from your CPT manual. Right? Percutaneous image guided procedures like CT or fluoroscopic performed with indirect visualization of the spine without use of any device that allows visualization through a surgical incision. Okay, next one. Under what circumstances should we quote 63052 or 63053? Quotes 63052 or 63053 be reported in addition to the posterior interbody fusion code. Option A, for any laminotomy performed to prepare the interspace for fusion cage. Option B, decompression is performed at different vertebral level than the fusion. Option C, decompression beyond the preparation of the interspace for fusion is required at the same anatomical site. Option D, only when the surgeon uses endoscopic approach for the decompression. Okay, we just done a scenario on this one. Come on, Curtis, give your best answers. Excellent. Yes, it is option C. When a decompression beyond the preparation of the interspace for the fusion is required at the same anatomical site. These are add-on codes and they should be done when there is a significant enough decompression performed, not for just for the inter space creation for the fusion to happen. All right. So next one, which approach involves decompression via substantial portion via removal of a substantial portion of the vertebral body using transthoracic thoracolumbar or retroperitoneal pathway. Is this option A, laminotomy? Option B, vertebral corpectomy? Option C, rhizotomy? Or option D, laminoplasty? So we can look into the keywords to answer this one. Okay, I can give you a small clue. Removal of substantial portion of vertebral body. Okay, you can forget everything else. You can just focus on that one. Removal of a vertebral body. Remember in the first slides which I shown the different definitions, different procedure for decompression. What do you call when vertebral body is removed? Yes, the correct answer, absolutely yes. The correct answer is option B, vertebral corpectomy. So corpectomy or vertebral corpectomy is defined as resection of substantial portion of the vertebral body through various surgical approaches, right? So that's the correct answer. Wonderful job, coders. You were all active today. Active, excellent, excellently. You have done a great job, and you were active in the chat as well. That's really, really impressive. So, how did you do, coders? I really hope this session helped. I know we went with a little bit more pace than usual, and if you want to watch again, the playback is always there in our AMCI playlist. Yes, all you have to do is to go to the AMCI channel and locate the CPT guideline mastery playlist over there, and you will find all the session, all such CPT guideline based sessions which we have done over there in the past over there. Okay, so coders, once again, Finally, I would like to remind you all to please do fill out the survey form. I've placed it in the chat over here. Yes, please do take a moment to fill that survey form. It will definitely will take less than a minute. Okay, and that's all we ask. Please also you can let us know the topic which you have in your mind so that we can take them and we can consider them for the next week's session. And next week we will be covering one topic from maybe uh radiology, or we were going to cover a topic from, I think it's radiology. Yes, I believe it's a radiology. Okay, you can let us know which topic you want us to cover, and also let us know how did the session help you. And with that, we come to a conclusion of today's session. Thank you, my team. Thank you, Miss Mills and Miss Catherine, in the chat, always assisting the students, encouraging them. Thank you, coders, for joining with us today. If you really enjoyed the video, please don't forget to hit that smash that like button and subscribe to our channel, and also share these contents with someone who really need to see them. Okay. Finally, please don't forget to leave us a feedback. The links are in the chat. And we are going to come back with a new topic next Friday. As I said, you can let us know in the chat, or not in the chat, the survey link, the topics which you are interested to hear from us. And till then, stay safe, keep coding. Happy weekend to all. We'll all see you next Friday.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.